So November is Prematurity Awareness Month, and March of Dimes has announced New Mexico's premature birthday report card for the year. Here with more on the report card and the importance of lowering premature birth rates in the state is Becky Horner. Thank you so much for joining us this morning.
Thank you for having me.
First, let's talk about the report card in general. Why is it so important that we know this information?
Well, as you mentioned, November is Prematurity Awareness Month, and this is a great opportunity for the March of Dimes to highlight our progress towards reducing the incidence of premature birth in our country as a whole and in New Mexico and all the other states.
So where do we rank?
Well, we got a C on our report card,
Okay.
which is the same grade that the United States got as a whole.
So it's not bad,
It's
but
not
we can
bad.
improve.
We have some improvement to
Okay.
do. It is important to note that since 2006, when we've been tracking this reduction in premature birth rates, the state of New Mexico has seen a significant decrease in our rate of premature births from 14% to now just about 11.6% of live births.
So our grade has actually increased or gone up, I guess.
Yeah, our grade has improved over that time period, and we still have 1 out of every 9 babies is born premature.
Okay.
So we still have some work to do.
So that's clearly just too much.
Yes.
But this report card, it also lets you guys know where the areas that you need to work on, or I guess to help women to work on. Is that correct?
Yes, it gives us an idea of what's happening in our state. One thing is our rate of uninsured women. We still need to work on that. We have about 26% of all women of childbearing age who don't have health care coverage.
Now, is that a big issue when it comes to premature birth? A lot of women, they don't have insurance. Are they just not wanting to go to the doctor because they don't have insurance, so they don't know, what is happening along with their pregnancy?
Right. Well, that can be a factor, and the March of Dimes is very adamant about making sure women have access to good prenatal care and go early and often to see their doctor and understand the signs of preterm labor and what to look for and have those conversations in case any risk factors do pop up.
So let's talk about what contributes to premature birth.
Well, we do know that maternal age can have a factor. So if you are a very young mother, teenage mother, or over the age of 40, you can have an increased risk. You can also have a risk if you are a smoker, but many times a woman can do everything right and it can still happen.
Okay.
So that is important to note, and that is why the work of the March of Dimes is so important, that we continue our research in finding out what causes preterm labor and how to stop it from happening.
So the key is knowing what, I guess, the symptoms are if you are going into labor early, so you can get to the hospital and hopefully they can stop it.
Right.
Or at least maybe give you a few extra weeks or months.
And it is really important to know that even a few extra days or an extra week can make the difference in the quality of life of that baby and the outcome.
So tell me about the March of Dimes programs. How are you guys efforting help to reduce premature birth in our state? How are we trying to improve this grade?
Well, one thing the March of Dimes has come up with is a program called Healthy Babies Are Worth the Wait. And through this program, it's an education piece where we encourage women and their healthcare providers to avoid scheduling early elective deliveries before 39 weeks of pregnancy if it's not medically necessary. So that is important. And also, if you're a smoker, we have tools in place to help you stop smoking. We support community programs that also assist women who may be abusing substances to seek help and get treatment for the health of their baby. So those sorts of things are in place. And then, of course, just educating the public and women about the importance of prenatal care in the health of your pregnancy.
We have a lot of mothers that actually do watch our show. So what do you tell them, or what can they do to make sure they do have a healthy pregnancy and make sure it's full term?
Well, as I mentioned before, you can do everything right and it can still happen.
Okay.
So there's a lot of research that still needs to happen onto the causes of preterm birth. But to increase your chances of having a healthy pregnancy, please see your doctor and plan your pregnancy. Have a preconception checkup. Make sure you go to all of your prenatal visits. Take a B9 vitamin, folic acid, before you become pregnant and in pregnancy. Know the signs of preterm labor and have that conversation with your doctor.
And you mentioned smoking, drugs, also a factor for premature birth.
Yes, if you are smoking, please stop.
And that also causes low birth rate, correct? Even if you do have a full term.
Yeah,
it can cause low birth rate.
It can cause low birth weight,
which is very dangerous.
Lack of oxygen for the baby. So, you know, just try to be healthy, be active, see your doctor.
What has the response been from women that maybe don't have insurance, and you reach out to them and say, we're going to help you through this? What has the response been from them?
Well, it's always a challenge in New Mexico to get access to care. So one thing that we're doing is really trying to work with community programs and put people in touch with those people within their community who can assist them in finding care and getting access to the care that they need.
Okay.
So.
For more information on the March of Dimes and what we just talked about right now, go to our website, krqe.com. We will be right back.